afternoon, student. So, let us continue with the ophthalmology. In a previous lecture, we was learned about the diseases of the vitreous. So, in the today lecture, we will study about the homeopathic therapeutics for the diseases of the vitreous. So, for the vitreous opacities, that is, in there is diffuse and turbid. There is a very different remedy for this. That is, for the diffuse vitreous opacities, there is a hemamalis, hiparsal, kali iode, mercor, mer iodum rubrum, and thuja are useful. And for the turbid vitreous opacities, Cholesterinum, kali iode, phosphorus, prunus spinosa, seneca, solemn nigrum, and sulfur are useful. So, Hamamelis virginica is a very good remedy for the vitreous opacity. When there is a objectively the patient shows the lids are solid with the eyes are bloodshot, and subjectively the patient feel that eyes feel forced out and there is a sore pain in the eyes. So the characteristics of patients is very important that the sphere of action of hemorrhage is a passive congestion and venous hemorrhage. So clinically there is a traumatic iritis with hemorrhage. It has been a most service for hastening of absorption of intraocular hemorrhage. So there is a intraocular hemorrhage which leads to the eyes are bloodshot and swollen, and there is a passive congestion with the venous hemorrhage. Then hypersulfurous, that is hypersult. Objectively, the patient shows that there is upper lid are red, swollen, and inflamed with the pressive pain. There is a morning agglutination with the inflamed eyes and white red. Profuse lacrimation spontaneously closed lid in the morning. Subjectively, patient shows that there is intense photophobia and eyes are very painful or achy in bright daylight as if attempt to move them, and eyeballs are very sensitive to touch. So there is a pains are very important, that is sore as if bitten, pressive pain, throbbing pain, shooting and smarting pain. The smarting pain in the external cancers with the hardened mucus and pressure in the eyes as from the side. So visions shows that there is a obscuration while reading. There is a dim sight by candlelight and blindness on rising and standing after sitting bent over. So the field of the vision reduces one half, and there is a continual movement of the bright circles before the eyes. The object looks too large. The characteristics of this is shows that oversensitiveness of the nervous system, hence there is a extreme sensitiveness to the touch, to cold air, and to cold application. The sensitiveness makes the subject irritable and with the hasty speech and actions. So clinically, there is a blepharitis, keratitis, palliaticular inflammation of the cornea, corneal opacities, suppurative choroiditis, acute phlegmonous inflammations, and pustular and ulcerative keratitis with the great intensity of symptoms. There is a deep slugging corneal ulcer with hypopyon and corneal abscesses. So there is a keratoiris and catarrhal or purulent conjunctivitis and also iris. So this is all about the repulsor. Then next remedy is a kali iodine. A diffuse keratitis developed during the administration of this remedy and improve rapidly upon discontinuing the drugs. There is a edema of the lids with the purulent conjunctivitis and chemosis. Lacrimation. Then subjectively the patient feels that eyes are burnt. There is a pain over the left side of head and in the eyes. So there is a dark and stormy days. Vision is a dim and foggy. Characteristics that when these remedy that is Kali iron is thoroughly indicated, there will almost always be an edematous or infiltrated state of the affected part. Then clinically, Kali iode is very useful for violent syphilitic iritis. After the abuse of mercury, iris is much swollen. There is aqueous, cloudy, ciliary injection mark, a bright angry red, and pain at night may be very severe. There is a photophobia and lacrimations are variable. So has help orbital periostite syphilitic or not. Pain are intense or absent. Pustules of cornea and conjunctiva. A very prominent remedy for acute or chronic iridochoroiditis and especially if syphilitic with the excessive and variable amount of the haziness of the vitreous. So, next remedy is the Mercurius. Mercurius, objectively, patient shows that there is a upper lid are thick and red, like a star. Eyes are inflamed with the swollen tarsi and are very sensitive to touch or light. The lids are spasmodically closed, acrid lacrimation, and there is a morning agglutination. So eyes are forcibly drawn together. There is an inflamed swelling in the region of the lacrimal gland. Subjectively, the patient shows there is a photophobia, gas light, intolerance of the light, and firelight. So there is a heat, redness, pressure in the eyes with the burning and biting pain. Sensation of a cutting substance under the left upper lid, and there is a choroiditis. So disseminated and simple. The vision shows that there is a dimness, a fog before one or both eyes. Eyes are drawn together or trying to look at anything, cannot see it distinctly, and the more she tries, the less able is she to restrain the contraction. She is obliged to lie down and close the eyes. So there is a blinded by firelight in the evening. Characteristics shows that there is aggravation from night. Discharges are thin, sand acrid by the glare of fire. Clinically, syphilis is marked. There is a dacryocystitis, syphilitic lacrimal fistula, eyes trouble from working over a fire, and there is a ophthalmia neonatal. So superficially, inflammation of the cornea or conjunctiva with the cataracts reticular or ulcerative conjunctival redness is variable. It is usually mild. Sometimes there is a chemosis and keratitis usually from hereditary syphilis. Keratohydritis with or without hypoplia. There is a episcleritis, blepharitis and iris. Mercurius pains are generally severe, more frequently tearing, burning, shooting, or sticking, and not confined to the eyes but extend into the forehead and temples. Temples are often sore to touch. There is iritis, retinitis, suppurative choroiditis, and optic discs. Then next remedy is the phosphorus. Eyes are sunken and surrounded with the blue rings. Eye seems large. There is edema of the lid and around the eyes. There is a ptosis and myopia. Subjectively, patient shows that there is a feeling of aching and burning pain in the eyes. There is stiffness and heat with the dull pain after reading. Regions in this, there is object look red, letters look red when reading. There is a hemerolopia, day blindness, sees more distinctly in twilight than during the day. Eyes gives out while reading. Characteristics are there is a very sensitiveness to the external impression. And clinically, choroiditis shows that there is a disseminated and simple choroid inflammations. So there is atrophic ciliary neuralgia, blepharitis, keratitis, corneal opacity, myopia due to or increased by ciliary spasm and has been reduced perceptibly with 2x interval. So next is the spruce spinosa. The common name of Spruce spinosa is a black thorn. Subjectively, there is a pain in the right eyeball as if inner part of the eye would be torn out. A sharp pain shooting like lightning from the right forehead through the brain and coming out at the occiput. So characteristic shows that there is a neuralgia, usually a pressing pains, crush, or there is a shooting. Usually motion, maybe in the night, and occasionally period. So pruners relieve these pains and even the pathological conditions which they accompany. Clinically, it is an intense pain as if the eyeball must burst or as if the pressing as under or as if crush or wrench. The pain is often sharp, rising and beginning to walk about. Then the dark before the eyes in the morning, on rising from the bed, there is a transient obscuration. Vision are obscured with the nausea and pale face. Characteristics shows that a mild, gentle, tearful patient, usually a blonde, often a female. Amenorrhea is seen in that with the scanty or delayed menses may be irritable but is amenable to reason. To Negroes give pulsatilla if no other remedy is clearly indicated, it is aggravation better by warmth, aggravation from warmth and better by the gentle motion in full and open air. So there is a vertigo, fever without thirst, even when the patient licks his lips to moisten them. The characteristics that is mucus discharge is a black, profuse, yellow or whitish and thick. There is indigestion from rich fatty food 2 or 3 hours after eating. So clinically it is a valuable remedy and its selection should be largely governed by the temperament and general symptoms. There is a catarrhal conjunctivitis which is acute. There is acute phlegmonous dacryocystitis and sometimes will be abort. So there is a trachoma without venous, blepharitis, styes if given early and not too strong often aborted. And if continue prevent their recurrences with the purulent conjunctivitis Cloaculus ophthalmia and phylactecular conjunctivitis or keratitis. So there is a photophobia may be lacking and opacity of the vitreous humor. So this is all about the prunus spinus. Then next remedy is the senega. Senega is an important remedy in the vitreous opacity where there is a hyperphoria and which is better by bending the head backward. So it acts on the rectus superior. There is a blepharitis and lids are dry and crusty with the graphite. There is a dryness with sensation as if too large or orbit for orbits. There is a staring, lacrimation, flickering, must wipe eyes frequently. Hyperphoria, it is better by bending the head backward and it acts on the rectus superior. So Sinega, it acts on the rectus superior. There is a blepharitis, leads are husky and crusty, like a graphitis. There is a blepharitis, leads are dry and crusty, like graphitis. So in the Seneca, there is a dryness with the sensation as if too large or orbits. There is the staring, that is lacrimation, flickering, which is a must wipe, eyes are frequent. Object look shaded. There is a muscular asthenopia in like causticum. Then double visions better only by bending the head backward. Opacities of the vitreous humor promotes the absorption of the fragments of lens after operation. So this is the silica. The next remedy is the solar nigrum. Solon nigrum is common name is the black nightshade. There is a opacity of the vitreous humor, pain over the both the eyes. There is alternate dilatation and contraction of the pupil. So vision is a weak sight and there is a floating spots. Then next remedy is the sulfur. Sulfur objectively shows there is a lacrimation in the morning with the burning, which is followed by dryness and swelling and pain in the lid with lacrimation. Eyes are dry in the room and lacrimations in the open air. So, lids are red and swollen in the morning. Redness of the lids and conjunctiva. There are eruptions of the pimples on the upper lid and heaviness of the eyes. And there is a morning agglutination with the nocturnal agglutination. There is a redness of the eyes during the day with the violent itching in the evening and inflammation of the eyes or lids with the swelling, redness of conjunctiva and the white vesicle on the white of the eye which is close to the cornea. There is a purulent mucus in the eyes. Subjectively, the patient feels that there is a much itching in the brows and tip of the nose of the lid with burning. There is a dryness of the inner surface of the lid with burning, dryness, smarting, itching of the lid margin with the morning itching and sandy sticking and burning in the outer canthus. So there is a pricking in the eyes which causes to scratch and rub them. Biting of the eyes and lacrimation, every often a feeling of heaviness and aching in the eyeball when there is a reading or writing and anxiety. The characteristics that the patient shows there is a worse after washing and bathing. There is a early morning sulfur-worn is L'Oreal that chiefly in the chronic diseases, but it is known the less important in acute condition or as an intercurrent remedy. It is especially useful for people subject to the skin eruption or after such eruptions have been suppressed with the even many years before by local treatment and there is a sharp darting pain like a pink pricks. Then the Thuja occidental. Thuja is the last remedy for the vitreous opacity which shows nocturnal agglutination and pimple on the lid margin with the styes and right eye and white of the eye which is much inflamed. And subjectively, the patient feels that there is a tearing pain in the left brow which disappear after touch and lids are feel solemn and as if a foreign body were in the eye. There is a burning and stinging in the edges of the lid and evening and in the eyes with injection. So eyes feel dry, sandy. There is a pressure in the eyes, a painful stitch through center of the left eye. Commencing in center of the brain, there is a choroiditis and disseminated and simple iritis. So this is all about the homeopathic therapeutics for the diseases of the vitreous. Then the next topic of ophthalmology is the diseases of the retina. Applied anatomy of retina contain the following point that is retina is the innermost tuning of the eyeball. Is a thin, delicate and transparent membrane. Remember retina is the innermost tuning of eyeball. It is thin, delicate and transparent membrane. It is the most highly developed tissue of the eye. So it appears purple red color due to the visual purple of the rod and underlying vascular core. So in the retina there is underlying vascular choroid and the visual purple of the rod. That's why retina look a purplish red color. It is highly developed tissue of the eye, which is thin, delicate, and transparent member and the innermost unit of the eye. So the gross anatomy of the retina shows that it extends from the optic disc to the ora serrata. Grossly, it divided into two distinct regions, that is posterior pole and peripheral retina. It is separated by the so-called, that is retinal equator. And retinal equator, it is an imaginary line which is considered to lie in line with the exit of the fourth vena vertically. So, retinal equator, it is an imaginary line which is which separates the posterior pole and the peripheral retina. The posterior pole refers to the area of the retina which is posterior to the retinal equator, and the posterior pole of the retina include the two distinct areas which are optic disc and macula lutea. Posterior pole of the retina is the best examined by slit lamp indirect biomicroscopy using plus 70-80 and plus 90-degree length and the direct ophthalmoscopy. So, optic disc of the retina, it is a pink color. It is well-defined circular area of 1.5 mm diameter. The optic disc, at the optic disc, all the retinal layers terminate except the nerve fibers, which pass through the lamina cribrosa to run into the optic nerve. A depression is seen in the optic disc is called the physiological curve. The central retinal artery and the vein which is immersed through the center of this curve. Macula lutea, it is also called the yellow spot and is comparatively deeper red than the surrounding fundus and is situated at the posterior pole, that is temporal to the optic disc, and it is about 5.5 mm in diameter. Then the fovea centralis. The fovea centralis is the central depressed part of the macula. It is about 1.5 mm in diameter and is the most sensitive part of the retina. In its center is a shining pit called as a foveolo, that is 0.35 mm diameter, which is situated about 2 disc diameter, that is 3 mm away from the temporal margin of the disc and about 1 mm below the horizontal meridian, an area about 0.8 mm in diameter, which including the foveola and some surrounding area, which does not contain any retinal capillaries and is called as a foveolar avascular zone, that is FAZ. And surrounding the fovea are the parafoveal and perifoveal areas. So, this is a diagram of the eyeball which shows this is a optic disc which contain optic nerve. This is a fovea, this one the choroid, and under the choroid there is a retina, the external there is a sclera, and this one is the ora serrata. So in this diagram, that is diagram B, when we can see that this is a optic disc. This is the ora serrata. This one is the macula. This is a parafoveal region, and this center is a foveola, and behind the foveola or surround the foveola there is a fovea. These blue are retinal vessels, and these are this yellow part is a peripheral retina. So peripheral retina refer to the area which is bounded posteriorly by the retinal equator and anteriorly by the ora serrata. There is a peripheral retina is the best examined with the indirect ophthalmoscopy and by the use of the Goldman these minor contact mirror contact lens. So the retina is divided into the posterior part and the peripheral retina by an imaginary line. Then ora serrata. Ora serrata, it is the serrated peripheral margin where the retina ends. Here, the retina is firmly attached both to the vitreous and the choroid, and the pars plana which extend anteriorly from the ora serrata. So, this is the point that is ora serrata. Ora serrata, it is serrated peripheral margin. Where retina end. And here the retina is firmly attached both to the vitreous and the choroid. The pars plana extend anteriorly to the ora serrata. So microscopic structure shows that retina consists of three types of the cells and their synapses arranged from without inward. So in the following 10 layers, there is a pigment epithelium. Pigment epithelium, it is the outermost layer of the retina and is consists of single layer of the cell containing pigment. It is firmly adherent to the underlying basal lamina, that is bridge membrane of the choroid. The layer of the rods and cones shows that rods and cones are the end organ of the vision and also known as the photoreceptor. Layers of the rods and cones contain only the outer segment of the photoreceptor cell which are arranged in a palisade manner. There are about 120 million rods and 6.5 million cones. Rods contain a photosensitive substance, visual purple, that is rhodopsin, and a substance the peripheral vision and the vision of low illumination, that is scotopic vision. And cones also contain a photosensitive substance and are primarily responsible for highly discriminatory central vision, that is photopic vision and color vision. So There is a gross anatomy of the retina. In that A, that is part of the retina which contains a horizontal section at the level of the fovea and diagrammatic fundus view, and there is a fundus photo. Then the external limiting membrane is a fenestrated membrane through which pass a processes of the rods and cones. There is the outer nuclear layer. It consists of nuclei of the rod and cones. There is the outer plexiform layer which consists of connection of the rod, spherules and cone pedicles with the dendrites of bipolar cell and horizontal cells. Sixth is the inner nuclear layer is mainly consists of cell bodies of bipolar cell. It also contains cell bodies of horizontal amacrine and the molar cell and the capillaries of the central artery of retina. The bipolar cell constitutes the first order neuron. Seventh, that is inner plexiform layer. It essentially consists of connection between axon of the bipolar cell, dendrite of the ganglion cell, and processes of amacrine cells. 8. That is the ganglion cell layer. It mainly contains the cell body of ganglion cell, the second order neuron of visual pathway. There are the two types of the ganglion cell. So, the microscopic structure of the retina consists of that show in this diagram that these are the optic nerve fibers. These are the rods. This is the cones. This is the nucleus of the cone. And these are the nucleus of the rod. These are the horizontal cell. These are the bipolar cell. This is a parasol ganglion cell and this green is a ganglion cell. Then here is a tail layer. Firstly, this is pigmented epithelium. Then this is a layer of the rods and cones. Then third is the external limiting membrane. Fourth is the outer nuclear layer and fifth is the outer plexiform layer. This one. Sixth is the inner nuclear layer which consists of horizontal cell. Outer nuclear layer which consists of rods and cone nucleus. Then there are also amacrine cells which present in the inner nuclear layer. Then there is a seventh layer is the inner plexiform layer which consists of parasol ganglion cell. Then 8 is the ganglion cell layer which consists of ganglion cell. Then ninth is a nerve fiber layer. And last that is 10 is a internal limiting membrane. So this is a microscopic structure of the retina. The midway ganglion cells are present in the macular region and the dendrite of each cell synapses with the axon of a single bipolar cell. So there is a polysynaptic ganglion cell lie predominantly in peripheral retina and each such a cell may synapse with up to 100 bipolar cells. There are the nerve fiber layer that is stratum opticum which consists of axon of the ganglion cell which pass through the lamina fibrosa to form the optic nerve. And for the distribution, the arrangement of retinal nerve fiber. Tape, that is internal limiting membrane, it is the innermost layer and separate the retina from vitreous. So it is formed by the union of terminal expansion of the Mueller's fibers and is essentially a basement membrane. Structure of the fovea centralis shows that in this area there are no rods, cones are tightly packed and other layer of the retina are very thin. So this is the diagram of the microscopic structure of the fovea centralis, which consists of the inner nuclear layer. Then this is the inner plexiform layer. These black dots is the ganglion cell layer. Just above that there is a nerve fiber layer, and this line is the internal limiting membrane, and this center is a foveola. Then as we see, these pink circle oval shape are the retinal capillaries. Just below that, yellow is the outer plexiform layer. Then this pink dot, which is called as the outer nuclear layer, these lines is elongated cones. Under this there is a pigmented epithelium, this one, and just below that there is a choriocapillaries. So it's a central part of the fovea and largely consists of cones and their nuclei, which are covered by a thin internal limiting membrane. All the other retinal layers are absent in this region. In the foveal region surrounding the foveola, the cones axons are arranged obliquely. So this is a inlay layer to reach the margin of the fovea. So in this diagram we can see this is the area of the foveola and the layers are arranged obliquely. Okay. Then functional divisions of the retina. Functionally, retina can be divided into the temporal retina and nasal retina by a line which is drawn vertically through the center of the fovea. The nerve fiber arising from temporal retina which are passed through the optic nerve and the optic tract of the same side to terminate in the ipsilateral geniculate body, while the nerve fiber originating from the nasal retina after passing through the optic nerve which cross the optic chiasma and travel through the contralateral optic tract terminate in the contralateral geniculate body. Then the blood supply is there are the outer four layers of the retina, for example, a pigment epithelium, layers of the rods and cones, external limiting membrane, and outer nuclear layer get their nutrition from choroidal vessels. So there are the inner six layers get their supply from the central retinal artery, which is a branch of the ophthalmic artery. Central retinal artery emerges from the center of the physiological cup of optic disc and divided into the four branches. So, namely, the superior nasal and superior temporal, and inferior nasal and inferior temporal. So, these are the arteries For example, they do not anastomosis with each other. The retinal vein. Retinal vein These follow the pattern of the retinal arteries, and the central retinal vein drain into the cavernous sinus, which is directly or through the superior ophthalmic vein. And the only place where the retinal system anastomoses with ciliary system and is the region of lima criposus. So this is all about the applied anatomy of the retina. So, in the next lecture, we will continue our lecture with the congenital and developmental disorders classification. So, today we learn about the homeopathic therapeutics of the vitreous, that is diseases of the vitreous, and in the diseases of the retina, we was learn about the applied anatomy, that is gross anatomy, posterior pole, optic disc, macula lutea, peripheral retina, oracirata, its microscopic structure, that is microscopic structure of the retina, then microscopic structure of the fovea centralis, functional division of the retina, its blood supply, and retinal veins and central retinal artery. So today we stop here and we will continue our next lecture with the congenital and developmental classification. Till that, till that, have a good day and happy Christmas to all students. Thank you.